So other than endocrine gland, we have organs that can also secrete hormone. For example, our heart produces ANH, atrial natriuretic hormone. Our stomach and small intestine, they can produce some hormone that can regulate digestive secretion. And then we'll tell you other example. For example, leptin. Leptin is a protein hormone produced by the adipose tissue, that means our body fat. What it does is that it stimulates the satiety center in the thalamus, in the hypothalamus, to tell the hypothalamus that, oh, we are full. And then, but leptin in obese people may be ineffective. It may be difficult to activate the hypothalamus to tell us to stop eating. Growth factor, there are different growth factors. Of course, they induces mitosis. They also release, they can be released in the blood as well because it is similar to hormone. There's something called granulocyte macrophage colony stimulating factor. It causes the bone marrow stem cells to make more granulocyte and macrophages. Basically, that's the major function. Platelet-derived growth factor, wound healing. The reason is that it has something to do with platelet. And then epidermal growth factor or nerve growth factor, also for wound healing. It's just a general. And then prostaglandin is a big thing. Prostaglandin produced from arachidonic acid. Arachidonic acid will be converted into prostaglandin, and then prostaglandin is an inflammatory molecule. So when you poke your finger turns red and also swells. It is because of the effect of prostaglandin. And then it also, one of the major functions is that it causes the contraction of uterus during labor, during childbirth, or we call it parturition. So when the uterus contracts during parturition or childbirth, it is induced by prostaglandin. It also works with the pyrogen. Pyrogen is the molecule that will increase our body temperature so that we will have fever or temperature. So disorder of the endocrine system. There are lots of disorders related to the endocrine system. In too much or too little of the hormone can cause the pathology. And cancer or the tumor, if the cancer or tumor grows on endocrine gland, it will stimulate or increase the production of that hormone or the effect of that gland. On the other hand, destroying the gland or damage to those glands, endocrine gland, will decrease the production of the hormone. So remember, these two are the general rule in endocrine system and also in the nervous system. If you have a tumor or cancer growing in certain part of the brain, it will stimulate that part of the brain. If you have a stroke, that means not enough blood supply to certain part of the brain, causing the death of a certain neuron in that part of the brain, it will decrease the function of that part of the brain. So when our posterior pituitary gland secrete a little ADH, not enough ADH, what will happen? We'll have diabetes insipidus. Diabetes insipidus meaning that we will produce too much of the urine because we don't we don't get enough ADH, then we will have too much urine, then resulting dehydration. So if we have a damage to the posterior pituitary, so the posterior pituitary secrete less ADH, and then we'll have a large volume of urine produced, then it will make us dehydrate. And then another thing is called pituitary dwarfism. Pituitary dwarfism is also damage to our, but this time it is an anterior pituitary. Damage to the anterior pituitary will produce a little growth hormone. Little growth hormone will give people a short stature. On the other hand, if you have a tumor growing in the anterior pituitary, that will stimulate a lot of growth hormone, excess growth hormone in the secreted by your anterior pituitary because of the tumor stimulation, you will get gigantism. Acromegaly. Acromegaly, it is when you have too much growth hormone. Again, too much growth hormone. The bone cannot grow, but you can see that hands, feet, and facial bone, they look abnormal. And then Cushing Syndrome. Cushing Syndrome is because you have too much ACTH. Usually, you also have a tumor growing on the anterior pituitary. Anterior pituitary secrete too much ACTH, and then adrenal cortex receive too much ACTH, and then adrenal cortex will produce a lot of cortisol. When it happens, then it will cause fat deposit in the midsection of our body. You can see that in the Cushing syndrome, this woman, it has more body fat in the midsection, and theoretically, she also has a hump at the back of the neck. But after treating it, then she lose a lot of fat deposit in the midsection, and also the hump at the back of the neck is also disappear. Hypothyroidism. Hypo means low. That means we do not have enough thyroid hormone in our body. When we do not have enough thyroid hormone in the body, what will happen? If it is in an infant or child, we have congenital hypothyroidism. That will make the kid become very short. Severe case, it can induce mental retardation if the treatment has not started within the first 2 months. Okay, it's basically we just give them thyroid hormone to replenish the body. Thyroid hypothyroidism is the first one. Will cause a short body stature, and also it may severe case cause mental retardation. We'll talk about the other two, goiter and exophthalmic goiter. We'll talk about these two right now. Well, before that, we'll talk about Hashimoto thyroiditis. Hashimoto thyroiditis is a form of hypothyroidism, but it occurs in adults. So in the infant and child, if you have hypothyroidism, again, it will give you short stature, and maybe even causing mental retardation. But in here, the causes of the adult hypothyroidism or Hashimoto thyroiditis is because the immune system produces antibody that destroy the thyroid gland. So it's some kind of autoimmune malfunction. Mycema is a syndrome that is not treated for this condition. If you have hypothyroidism in adult, you have weight gain, hair loss, constipation, or slow heart rate. Again, treatment for the adult hypothyroidism is to give them thyroid hormone.